Hello everyone, welcome to Innovator Coffee, a podcast that bridges the gap between people and the world of AI and innovation. My name is Wickey and I'm the host today. Follow us to explore the top AI products, ecosystem insights, and emerging trends. Today, we're very honored to have Praveen with us. He's the co-founder of Bookend AI. Praveen, welcome. Can you make a quick introduction about yourself?
Yes, thanks for having me on, Wickey. I'm Praveen Pillai. I'm the co-founder and CEO of Bookend AI. We are a healthcare tech startup. Our ambition is to build what we call a full practice operating system for specialty medical practices with the intention of improving practice efficiencies. We're currently focused on the GI space and a lot of interesting, great things happening. So happy to be here to talk about that.
Yeah, thank you very much. So normally when we first start to talk about the session, right, we start with personal experience. So what personal experience convinced you that healthcare administration was the most urgent problem to solve with AI in the healthcare industry? I'm just very curious.
No, great question to start. Healthcare is obviously a very, personal thing. Hopefully for most of us, it's we experience healthcare in a preventative way. But more and more people in the United States are dealing with chronic illnesses. Right? We see a lot of different statistics around this. Nearly half of adults are dealing with some sort of cardiovascular disease. Nearly half of adults are dealing with hypertension. Breast cancer, colorectal cancer are on the rise. So it's more likely than not that all of us have dealt with some type of, the side effect or the dark side of health, if you will. And our team at Bookend is no different. Either personally or our loved ones have gone through and lived with and dealt with chronic illnesses. And, you would think of this time of going through something so difficult would be the time of greatest need, but it also happens to be, because of our healthcare model, the time of greatest frustration for a lot of people. Complicated diseases come with a lot of complicated and expensive cares, whether it's medications, procedures, but what this also means is that it comes with a lot of complicated insurance conditions. So because of the economic model of healthcare in this country, the time of our greatest need becomes our time of our greatest frustration. And we, right from the start, were very drawn to trying to transform that model as a company and really put our efforts to good use to affect the quality of care, the time to treatment for patients, and really just make a big difference in that space. That's really what motivated us. It is an industry where we have some of the greatest doctors fighting the fight to help the patients, but it's also a space where we probably have the world's worst paperwork getting in the way. So it just seemed like a really interesting and important area for us to focus our attention on.
Yeah, actually ask more about your product, right? What exactly your product do, and in the simple terms, what does a Bookend AI do today that healthcare system could not realistically do without AI?
Yeah, it's worth sort of thinking about the state of the healthcare ecosystem right now. It's gotten more and more complex as we know it. It's gotten so complex that you now have thousands of MDs, doctors in the US that work, for example, at insurance payers in administrative jobs versus actually providing care to patients. This is happening even though we have a shortage of doctors needed in the country to provide care to the population. And that's kind of really crazy to me. And this happens because you need these highly qualified and skilled people to keep this complex relationship between the provider and the payer going. You need these experts to analyze things like medical necessity documents and authorization requests and peer-to-peer reviews to keep the whole system sort of running. And this has led to over $1 trillion annually in terms of administrative overhead expense, and really it's starting to break the healthcare ecosystem completely. Until now, there's really hasn't been a way to get around this whole problem. But that's changed with the latest innovations around AI and large language models. We finally have the ability to bring human level comprehension and decision making skills into the mix. And you can have AI, for example, interpret like complex healthcare information and actually at or better than what humans can, and really solve this problem for the first time. So that's what we work on. We want to be able to harness the power of this technology and break this logjam in the healthcare industry where there's such an over-reliance on experts to really just make sense of the information and keep this administrative process in check, which just drives up cost, it delays treatment, it burns out doctors, and our ambition is to really change that care model.
Yeah, very curious, right? Because before the session, I did look at your background. You were from Google and Amazon. What makes you transfer from the traditional technology area to the entrepreneur with healthcare? Is there some like a story behind it?
No, absolutely. I spent my entire career working in tech in a variety of different roles. I've worked in different industries, but I also spent a significant amount of time as part of teams at Amazon Web Services and Google Cloud, building a lot of the fabric of the products in data analytics and AI. And the whole time, we saw our technology being used by companies in different industries and to really drive innovation and build products that are being used by end users and driving value in the industry. So I've always wanted to sort of, after a significant amount of time with those companies, find my way to a meaningful industry-specific area where we could drive end user products. And healthcare, for a lot of reasons that we talked about before, but also from our backgrounds, made a lot of sense. For example, we have people in the team that have worked in healthcare and were part of some of the early innovations around healthcare adjudication systems that happened, several years ago. And so we've lived the experience. We've seen what has worked and what hasn't worked. We also have the experience of, healthcare as recipients and patients as well. It just seemed like a time where we could bring all that together to really be part of the transformation that needs to happen in healthcare for all of us.
Yeah, and I also, right, for healthcare industry, I know in this AI wave, this is the biggest sector which venture put money in, right? But at the same time, this area is a little bit crowded. So what's your unique advantage to differentiate your company compared to other startups in this area?
Yeah, healthcare is a popular space where a lot of people are interested in jumping in and actually trying to solve problems. But it's a very difficult space to build products and actually deliver value in the industry. And a part of the reason for that is because, people think, there's so much data, there's systems of record, there's APIs, I should be able to build something very easily. But the reality is, you're dealing with faxes and you're dealing with handwritten notes and you're dealing with 15 different implementations of the same EHR that work differently for every customer. It's a very complex space that requires a lot of expertise in what it means to build systems that can extract value from that. And it's not an easy thing to do. So a lot of times we joke about how one of the superpowers of our team is the ability to endure the pain of building in this difficult environment. And so we bring decades of experience in building enterprise software. We've seen sort of the core of the latest and greatest technology in AI being built at these big companies. And we have sort of deep empathy for our users and respect for the industry and the regulations and the constraints that exist in the industry. Putting all that together, it doesn't happen as often as you think with startups. So that's what really I think makes us stand apart.
I see. Prior authorization and utilization management are deeply broken systems. Why did you choose to work within them instead of trying to disrupt or bypass them entirely?
A lot of times, we incorrectly sort of think of disruption as sort of having to burn the whole place down, to hell with it, like just get rid of it. But in healthcare, the patients are inside that building, right? If you try to bypass insurance as it exists today, you're going to effectively lose access to a vast majority of the population. And you can't really end up affecting the macro cost structure that we want to be able to positively impact. So we chose to sort of be the lubricant of the gears in healthcare, to reduce the friction and really help drive down this enormous sort of administrative cost that's out there to make healthcare more affordable to the people, to the patients, and more rewarding for the providers. So that's kind of how we think about it. Disruption can still happen without burning the whole place down, and we intend to do that.
Okay, so just very curious, right? So how is the Bookend AI fundamentally different from traditional automation or rule-based healthcare software?
Yeah, rules-based systems, even RPA-based systems, they've existed for a long time. And I mentioned, some of our team members have actually worked on some of the earliest rules-based healthcare claims adjudication systems. So we have a lot of personal experience with its limitations, if you will, right? Healthcare is a complex industry with complex vocabularies and complex needs, and it's almost impossible to build a rules-based system that will consistently work over time with all of the changing information and the needs of the industry. I mean, think of a simple example, right? You could have a doctor who's capturing information, notes about a patient encounter, and they might talk about it in different ways. They might, for something like shortness of breath, or somebody else might say difficulty breathing. Somebody else might use a clinical term, dyspnea. So, but even those things, those variations will very easily break rules-based systems. So that's why, while rules-based systems have existed for a long time, we truly have not been able to transform this administrative process and burden, because you still end up having these systems break and people having to come in and fix it because they cannot actually comprehend what those different terms are that all mean the same thing. AI can finally do it as well as humans can, right? So the technology is fundamentally different. We can actually mimic human level understanding and contextual understanding, and that's really what the big unlock is at this time.
Yeah, for healthcare industry, it's actually very complicated industry, right? It has multiple players in the same ecosystems. Just curious, how do you guys make your charging model? Which party do you guys charge, and how it goes through the whole system now?
Yeah, we there's a few sort of North Star things that guide us in how we build our solution and what value proposition we're trying to bring to market. There's been startups in this space that have sort of straddled the fence, if you will, and tried to service both the providers and the payers. But if you kind of think of it in a basic level, there is a bit of a conflict of interest that exists in that space if you try to do both. We were always pointed towards the providers. We're trying to bring systems and this full operating system experience to the provider ecosystem, to independent specialty medical practices, to help them improve their practice efficiency. So that's our customer, that's who we're servicing, and that's who pays us to use our product. The pricing model, as I'm sure you've heard from lots of different startups in the AI space, has evolved in different ways, and we've tested different things in market. We've had simple licensing models where our customers pay us a licensing fee for usage on a yearly basis. We've had sort of share of margin improvements as a pricing model that we've used. But ultimately, I think the one that's makes the most sense and will probably stick going forward is a usage-based model where we charge our customers for a certain workflow that runs through our system. For example, if we're helping them with their infusions business, they might use our coverage assistant tool to help make the right choice on the biosimilar infusions that they're trying to administer to their patients. And then our authorization assistant might take that order and run it through the insurance authorization process. And that whole workflow is charged at a certain dollar amount to our customer, who's the provider.
I see. So for healthcare industry, mistakes matters, right? Where do you draw the line between AI assistance and the human accountability? I think a lot of people talk about that right now.
Yeah, we think a lot about this. We're not advocating for AI to completely replace, humans. The sort of anchor principle that we have as a company is we want human experts in the loop, and we want them to operate at what we call the top of their license. So these are experts in their field, like for example, doctors who are trying to help the process. We want them to be doing the most complex and important job that they can be doing, not the mundane things, right? So that's what AI is here for. For example, I talked about our coverage assistant tool. Our AI agents do the work in the background of understanding and deciphering all of the complex insurance policies and figure out the connections between those policies and the patient's medical history. And with this, we can provide sophisticated decision support tooling to the physician who is trying to make a decision on a biosimilar for a drug that they want to administer to the patient. The physician still chooses the drug class that they want to have in the care pathway, right? But within that drug class, our tool can give you the right recommendation for the biosimilar that's going to match all the insurance constraints as well as the patient's medical history conditions. And that type of enablement tooling and support tooling makes sure that the humans can still operate at the top of the license, but AI is making their life easier. And we take the same principle and apply it on the administrative processes that we support as well. So that's kind of how we think about human versus AI.
I see. So a lot of AI companies, they have some kind of AI work, the majority of the work, but the human will do the validation to make sure the accuracy rate, right? Do you guys also encounter this kind of problem?
There's always all kinds of things that we do to do evals on the performance of our agents and the output that's being generated. We will work with our customers to determine, how comfortable they are with the performance of the agents, and we can sort of slowly increase the automation levels so that increasingly that the humans are only interacting with the agent's outputs in cases of exception handling, right? We do lots of different things to ensure that we have humans in the loop when needed. We've got sort of a lot of transparency into how the agents are performing and the quality of the output, and that we can sort of increase or decrease automation based on the level of comfort of our customers in the process.
Yeah, for again, like what you mentioned, healthcare industry is an industry which is really hard to get into on the business side, right? When you guys consider the go-to-market strategy of your company, how do you earn trust from the clinics and administrators who are already overwhelmed and skeptical of the new technology?
Yeah, I mean, this is one of the hardest problems startups have to solve, right? And a lot of times they kind of fall into the trap of like over promising and under delivering. We try to anchor ourselves on a few things, things like honesty and radical transparency. So we make sure that we are able to explain what we're doing and be able to prove what we're doing in a clear way to our customers, and ultimately don't overpromise. Like let the results speak for itself. We use those sort of principles to guide us, but the product itself has full sort of traceability with everything that we do. Our AI is not a black box. We have explainability for every one of the actions and recommendations that our solutions provide. So what it ends up being is we can consistently provide verifiable accuracy of the recommendations and solutions that we deliver to our customer, right? This is one sort of key area of IP, quite honestly, because if you think about it, we've built this platform that takes this awesome capability of LLMs and brings determinism, control, scale, repeatability, and structure to the output of what these LLMs can provide. So that's a very important element of delivering AI in healthcare, because you don't want to leave it to chance. You don't want to leave it to the probabilistic nature of the LLMs. You want to be able to harness the power, but at the same time bring determinism into the outcomes, and that's what our sort of IP and our product provides to the whole environment.
Yeah, I'm just curious. So like, I know it's always not very easy to get your customers, right? Do you have some like big win stories you can share with us? Just try to, you feel very excited like after you have it.
Yeah, it's obviously we're still a small private startup, and so we're not publicly talking about our customers yet. But what's exciting to me is when we see in this space, ultimately what are we trying to do? We're trying to improve the quality of care for patients, right, and improve the satisfaction for providers and allow them to actually practice medicine versus be administrative paper pushers, and that's really what we try to do. When a doctor comes and tells you because of your product, I don't have to spend all this time on paperwork. That means I can treat more patients and actually help the people in my community that need the help at these times of critical illnesses. That's rewarding, right? Because you've made the whole you made healthcare more accessible to more people at that point, and that's really what we're trying to drive. It's easy to get caught up in AI valuations and all these other things that come with it, but ultimately, if we can make healthcare more accessible and affordable to more people, then we've done our job.
I see. So for startup, it's not always easy, and it's not always the flat road, right? Always like something like you're trying to have like a up and down, right? So what has been the hardest what has been the hardest reality check you faced when deploy the AI in the real healthcare environments?
Yeah, we touched on this a little bit. It's the reality check that a lot of startups end up facing in healthcare. It's primarily has to do with the messiness of the data and information that exists within healthcare. Again, a lot of people jump in thinking like, yes, we should be able to build health systems and solutions in healthcare. All these things exist. There's systems of record. There's APIs. There's EHRs. Like we should be able to go in there and build on top of this very easily. But that's not the reality. More often than not, you're going to end up with difficult situations where accessing and really making sense of that data is not that easy, and you're dealing with lots of different versions of the same systems. You're dealing with manual paperwork. You're dealing with different doctors' offices that use the same system in different ways, and the data is in different places. And so the hard part of it was really just building the kernel with all this complex pipelines and context engineering and the reasoning agents that can make sense of all of this data and bring it all together. That was a harsh reality check for sure for us in terms of how fast we could build and deliver solutions in this space. And then the other part of it, ultimately you're trying to land new technology in these doctors' offices who are already overwhelmed and are trying to keep up with just taking care of patients. It's a difficult thing to get their time and attention to be able to implement a new system. So, the first few customers are extremely difficult to get through. But as we start showcasing value, then the conversation sort of shifts, right? So, like, for example, we initially focused in the GI space. As our early GI customers started seeing meaningful value, the word kind of spreads in the ecosystem, right? So people are like, okay, I see that you've done that, and that's in that practice, and I want to be able to repeat it for mine. So that's helpful, but the starting point is certainly difficult.
I see. So how did you finally resolve that data availability problem? I think it's very difficult, right? Because there are a lot of regulations and compliance in the healthcare industry.
I mentioned before, one of our superpowers is the ability to endure pain. So there was no shortcut to this. You have to go in and you have to kind of see different scenarios and build to solve those scenarios. This is a lot of our core tech, and for example, our EHR integrations and our patient medical history processing engine was all built by actually enduring the pain and seeing different cases and working with different customers and understanding what needed to be solved. And it's an ongoing thing. I'm sure we'll come across even new scenarios we haven't thought about as we onboard even more customers. So there's no shortcut around it. It's the work that we had to do. It's technology that we, I will say, given our backgrounds and our focus on building sort of this full operating system experience, we decided to first build sort of the kernel component of it, which was all about bringing data together. We didn't rush into like just one point solution, and get stuck there. If we had done what a lot of different startups did, which is focus on like one piece of the puzzle and try to like optimize just over there, it would have been much harder for us to build sort of the underlying platform and data connectors and make sense of all this information that we've been able to do. So it took us a while to get started, because we had to build that core component of the kernel. But now, as we expand the portfolio of products and solutions that we have across the whole workflow, we can do it much faster because we have that kernel in place.
Yeah. What is your ideal customer profile at this moment?
So, we're selling into independent specialty practices in key specialty areas. We started with GI, and that's really where most of our focus has been, but we will expand into other specialties like oncology, cardiology, neurology, etc. But we sell into independent practices, and when you think about independent practice groups that exist in these different specialties, there's usually three broad tiers of practices. You have the platform players, the mega groups, which these are big groups of physicians, could be in the hundreds, if not more than 1,000 physicians that band together and create a platform like a GI platform. An example of that is like GI Alliance or United Digestive. Those are the types of big players that exist in that space. That's tier one. Tier two is you have the regional players who, they might be 30, 50, 60 physicians that are banded together in a region and have a practice group that they run. And then you have the tier three customers that are smaller independent practices that may have, anywhere from 5 to 10 physicians that are part of the group. So, we try to sell across all of those different tiers. Our system is pretty scalable up and down that spectrum. But our target customer is is an independent specialty practice, starting in the GI space, but very soon into other specialties as well.
That's very cool. So what parts of healthcare do you think AI should never touch?
It might be controversial because AI is the answer to everything now. But call me old school, but I would say the empathy side of healthcare, I believe, still needs sort of a human touch. I'll give you an example, right? So I have a family member who is dealing with advanced dementia, and it's a very difficult situation, needs a lot of care. And honestly, the thing that makes that situation maybe a bit more tolerable are the caregivers who are involved in giving care to that person on a daily basis. I shudder to think what would happen and what that would feel like if we brought in robots and AI to do that empathy side of healthcare.
Yeah. So looking 5 to 10 years ahead, what does AI native healthcare workflow looks like if things goes right?
You want the complexity, I think, to be invisible. I think that's really what we should be aspiring for. My goal is to have a healthcare experience that is a direct sort of meaningful connection between the physician and the patient, right? Like the rest of the administrative tasks should just disappear for them. It should work seamlessly. It should not cause any disruption. It would be amazing if vocabulary like prior authorizations and claims and all of these things just become historical artifacts. Like, doctors don't worry about that anymore. They just focus on care. So I guess if I was to say in one word, what I want to do is like to make the complexity invisible and really go back to the basics of physician-patient experience.
I see. Yeah. So what has building a Bookend AI taught you about the difference between the technology possibilities and the real world impact?
Well, if you really think about it, in this case, we're talking about the latest generation of AI and LLMs, these things are inherently probabilistic, but a lot of times people get caught up in benchmarks and to compare and contrast how these large language models work, and you might think in a technology success could be when these models are, for example, successful 99% of the time, and that seems like a very high number and something that's a huge achievement. But in the case of healthcare, if that 1% where it failed happened to be a wrong recommendation or a guidance that affects, let's say, a pediatric oncology case, that is a huge real-world failure, right? So for me, we try to measure impact based on outcomes, not benchmarks. So I would say that's the biggest sort of like difference between sort of real world outcome expectations and like the getting caught up in what does technological success mean.
Yeah, exactly. I'm also curious, right? What do you think there's one thing you shouldn't do, and if you can redo it, you can do it very well after you start your business? There's so many things that I would that I've learned as part of building something from scratch and trying to create value for our target audience. But I would say make sure always that you're building or you're starting something with the right team in place. I think that's going to make the biggest difference in the outcomes that you are able to ultimately generate, because building a startup from scratch is no easy feat. I'm sure
some people have all the luck and right from the start they have all kinds of success, but 99% of startups go through a very difficult period of finding their way through the maze of building a company. And you can only do that if you have the right team with you. So I would say if there's one thing above all that you want to get right is to make sure that you're starting it with the right group of people.
Is it your first time to do the startup?
Yes, it is. My first time to do a startup. I spent my whole career in big companies, always wanting to do a startup, but never quite being able to pull the trigger. But something clicked in the last couple of years, and the opportunity with AI, sort of the compelling reason to go do something meaningful in a place like healthcare, and ultimately the right group of people who had the same vision and wanted to do something together. All of that finally gave me the courage to go do this.
Yeah. So, what are the resources really help you when you start this journey?
I think it's important to listen and learn from as many people as you can. I think a lot of times, we fall into the trap of relying too much just on ourselves and just trying to white knuckle the whole thing and figure things out. But the reality is there's so many people who might have gone through a similar experience who could have some very meaningful advice and information that they could share for you if only you would ask, right? A lot of times we're too shy to ask that question to somebody else. I would say certainly leaning in and making connections and learning from other people is an important aspect. And in the same breath, I would say, having gone through this, it's my responsibility to also share it with others as well who might be starting off. So, you have to repay that the kindness that you get from other people early on in a way that might help others. So that's something that I take with me every day.
Yeah. So if you try to share some tips to our audience, some of maybe entrepreneurs who just started, what will be the tips then?
Have patience and be ready to persist and persevere through tough conditions. Know that prepare for a scenario where not everything is going to fall in place the way you think it should, right? So I think that is something that people don't quite think through. What if you don't get that investment you were banking on? What if that customer implementation fails? Don't always just plan for the best case scenario, plan for the worst case scenario as well. And make sure that you have the support you need to persist through whatever ups and downs you might come across in your life trying to build a company from scratch.
So what was your most painful experience during this journey, and how do you resolve it at the end?
For us, I would say there were several that probably come to mind. But for us, we had to make some key decisions on pivots that we made in the company that now, in retrospect, they're all the right decisions to have been made. But it was very difficult at that time to make those decisions. At first, we started a company that was not healthcare focused. Was a more horizontally focused company, and we were trying to build a platform that could apply to a few different verticals. And we had some very opinionated things that we brought to the table based on our experience of what we wanted to do and how we wanted to deliver the experience. But as we worked with the design partners, listened to customers, we had to sort of make a difficult call of putting all our eggs in the healthcare basket and really just focusing and going deep in that one vertical. That was a very difficult choice for us to make, but one that, in retrospect has paid out for us, but it could have not worked out as well, so.
I think one of the most difficult decision for an entrepreneur will be the pivot point, right? Because you've been spent so much energy and emotion in your first idea. And how did you persuade yourself, okay, let's change the direction at this moment?
The team that we have has been, I think that's one of the advantages of having an experienced team in place, because we can kind of look at what we've built and find ways to potentially still use it, but also acknowledge the realities of the market that we were facing and the feedback we were getting, and really just leaving some of your pride at the door and really just looking at what's the best situation for the company as a whole, and for the time and effort we want to put into something that we all feel meaningful. So I would say having the right team helped me make that call and really just push forward with it. We really kept the team intact even through the pivot. Like, we didn't lose anybody because we all believed ultimately the core mission still translated to what we were going to do in healthcare, and they just kind of committed to it and pushed forward. So yeah, I think I had the right team help me make that decision.
Yeah, and also as a founder, right? Most of the founder they had a challenge to start to sell their business because their previous background from like a big company, and there are a lot of privileges at that time, and also has like kind of like an engineer or product background, right? How do you overcome that?
Yeah, it's funny, right? Like selling inside from Google or Amazon or Microsoft or whatever these big companies are that we worked in is a very different ballgame, right? Like, you have the brand, you have the reach, you have the resources, you have everything to try and make your case. It's much more humbling trying to do that as a startup who nobody knows about. But a lot of times, we overemphasize on sort of the product and engineering backgrounds of founders in small companies. But I think the go-to-market experience is equally as important, especially in what we're trying to do, in being able to actually take this complex product to market in a complex industry. And that's where our experience in go-to-market, my co-founder, has been a go-to-market leader in a variety of different companies, small and big. And we just rolled up our sleeves and we're able to go in there and just clearly articulate value, be very disciplined about the target customer we're going after, and really just be able to, really just keep nailing down like the specifics of what we're trying to do, who we're trying to do it for, and having the discipline approach has been super helpful for us.
Yeah, I think the most difficult part is like you're entering into a new industry, right? And you're trying to persuade all those experts in this industry, which makes things more difficult as well.
Yeah, it was very difficult to get started. We had to lean in on a lot of our network. We had to lean in on our backgrounds and our connections, if you will. And as we started showing results, the conversations get much easier, right? So there's certainly a big hump you have to get over initially, while you're sort of building the product, gaining credibility, and things get a little bit better over time. But certainly, it's not an easy thing to do, and in a space like healthcare, it's exponentially harder to do.
Exactly. So what question do you wish people would ask you about Bookend AI, but rarely do?
I think it's important to talk about what we are trying to accomplish here, right? We are trying to build towards an outcome where, possibly we make a huge dent on $1 trillion annual expense in administrative overhead costs that exist in the healthcare industry. The question we can ask ourselves is, what does that future look like if we actually make that dent, without affecting any critical services, right? What does it look like for families to be able to afford healthcare? What does it look like for physicians and nurses who now have time to spend with patients rather than paperwork? I think the outcomes that we're building for is an important question as a motivating factor that should be asked more often, right? It's not always about just what are you driving in revenue and profitability and valuations, and we get so caught up in sort of the mechanics of building companies. But the actual motivating factors are like much more altruistic than that. Like that, we really need to think about what it is that's motivating us to keep going.
Sounds good. We're towards to the end of the session. If there's a question we didn't ask but we should, what that would be?
We talked about lots of great things today. For us as a small company, building in this space, it's been difficult but exciting. We hope to connect with others through forums like what you bring to the table to really bring light to what's happening in this industry and the potential for transformation. And we're very excited about the future.
Yeah, and also some quick question, right? So first one is, if you try to recommend a book to somebody, what that book will be?
I'm rereading the Hard Thing About Hard Things from Ben Horowitz. I think it's a book that's worth dusting off every now and then and rereading if you haven't read it in a while. There's so many great lessons in there that I remind myself that even a great entrepreneur like Ben had to go through, that is helpful to remind yourself as you're going through some dark times in this journey.
Yeah, and second one, believe it or not, actually our podcast also has very high ranking on the AI job sector. Mm-hmm. Do you want to hire somebody recently for your company? Maybe you can.
We're always looking at great engineers and product people to join the company. We have some new additions that just recently joined, which we're very excited about. Some old colleagues of mine from Google and other places. So we're always looking for engineering talent to join the company.
Yeah, and then the third question is, currently, I know you are very focused on your business, right? But did you see something interesting in the AI world you want to share, either like an interesting product or like interesting things going on?
I mean, there's so many interesting things that are happening in AI. It's really hard to sort of just pick one. I would say there's an interesting evolution with in sort of, we just talked about hiring engineers. What's happening with vibe coding tools and coding agents. What does that mean for software engineering as a whole, and product development and building in the future? I think that's a very intriguing thing to keep an eye on, because we're looking at a world where the cost of building products is dramatically shifting, but at the same time, you need the expertise in-house to ensure that you're building stuff that'll sustain and last for a long time. So we're keeping a close eye on the evolution of vibe coding agents and software development as a practice overall.
Cool. At the end, right, if you try to give one sentence or two sentences to our audience, what that would be?
I would say keep innovating, keep dreaming. I think it's becoming more and more possible for people with ideas to make a difference and bring products to the world. So I would encourage everybody to try the entrepreneurship journey at least once in their lifetime. It's going to be hard, but it's going to be incredibly rewarding, and I think it's an important experience for people to have if they have a chance to do it.
Sounds good. Last two questions, if you don't mind.
Yeah.
One is like, how do you feel about the security and compliance impact to your business? Is there any difficulty when you try to build up the product or sell your product?
No, I mean, it's highly important. I mean, we're dealing with people's personal health records and personal information. I would say any startup that's trying to work in the space, make sure you respect the regulations. Don't always try to build fast and break things. Not in healthcare. I think that doesn't quite work. You have to pay attention to to what you're doing and ensure that you're always protecting the data, protecting the information. We're of course, HIPAA certified, we're SOC 2 compliant. All of these different things are table stakes in our view, and we spend an incredible amount of time building our architecture from the ground up to be completely about data isolation and data protection, even at the cost of sometimes making things harder for ourselves. I mean, there's a lot of startups that will try to pull data from different patients and providers to try to train models and things of that sort. We don't do any of that. We highly respect the ownership of the data from our customers, and I think respecting the regulations is an important principle to have as a startup in healthcare.
Is there anything you want to add on in today's session?
No, I think we covered a lot. It's been an interesting discussion. I'm grateful for your invite to be a part of this.
Thank you so much for your time today.
Awesome, Wickey. Thank you so much. I really appreciate it.
That's all for today's episode. Thank you for tuning in. We hope it sparked some inspiration for you. If you enjoyed our podcast, please like, share, and leave your thoughts in the comments. You are also welcome to join our WhatsApp listener group to dive deeper into the topics and exchange ideas with others. Bye. Woo!